I'm gonna go ahead and start. So I wanted to start with a quote, and it says, "The health of a nation is largely a reflection of the past and present health of its children." So we all here realize the importance of focusing on children and their health. And so I'm going to be referencing throughout this presentation an article from the CDC called "The Role of Schools in Preventing Childhood Obesity." And Jesse's going to put that in the chat box. But it's basically talking about the importance of doing education in school settings. So they state the physical activity and eating behaviors that affect weight are influenced by many sectors of society, including families, community organizations, healthcare providers, faith-based institutions, businesses, government agencies, the media, and schools. The involvement of all of these sectors will be needed to reverse the epidemic. So we're gonna start out. Dr. Jeffrey is actually going to explain the obesity framework. She had referenced it at our first Project Echo, and we're gonna go into it in a little more detail. So Dr. Jeffrey, can you go ahead and explain it?
Hello to everyone again. And I'm gonna let you know that this is the framework that Keys for Healthy Kids uses not only in really all of our work, but especially with Miranda's piece of our pie, pun intended, with the Clinical Community Collaborative. And this framework is from the article authored by Bill Dietz, Dr. Dietz, and many others. That's a model framework that integrates community and clinical systems for the prevention and management of obesity and other chronic diseases. So obviously we use it for obesity in pediatrics, but all chronic diseases, you can just plug this in. The reason I like this framework is that it's based in not only population health in general, but that it also always includes training and education, not only for impact, but also sustainability and raising our youngins to fill in our shoes when we decide to retire, and also health equity. Because definitely with a lot of the obesity and chronic disease work, we know sometimes we create more of a disparity, which is not our goal. There are metrics for our work. We use the SNAP Ed framework. Down here in integration is Keys for Healthy Kids and other such like organizations. And hopefully with the three sectors that we always want to be interconnecting and understanding what each of us is doing, you can find yourself in one of these, whether it's in the population health as a researcher doing metrics, in the training and education, addressing health equity specifically, or if you're a family or individual, or you're one of those community systems or programs that serves either the care delivery or the family and individual. So here are our practitioners. So I often get asked from other pediatricians, well, I do want to do more, and I know there's more than the care that happens inside my 4 clinic walls, but I'm not really sure how to go about that. So this model is what we're working in so that we can answer those questions and really connect care delivery to community systems, and so that there is a continuous communication, again, not only for impact, whatever the program is, to bring as many partners on board, and then also for sustainability. Miranda, I hope that's what you wanted me to do.
Yeah, thank you. Yeah. So from the article, they said that research has shown that well-designed, well-implemented school programs can effectively promote physical activity, healthy eating, and reductions in television viewing time. So in the article, they actually discuss 10 key strategies that schools can use to improve student nutrition and increase physical activity. And we're going to discuss ways that those strategies are being implemented in some of the schools in West Virginia. So the first 3 are: implement a high quality course of study in health education. Number 2 is implement a high quality course of study in physical education. And then number 3, increase opportunities for students to engage in physical activity. So we're going to start by talking with Krista Mccartney. I'm really excited that she's able to be with us today. She's the West Virginia SNAP Ed Director and WVU Extension Public Health Specialist. Her current roles include creating and carrying out a public health agenda, which focuses on increasing healthy food access and improve school and community environments for limited income audiences. She is also a registered and licensed dietitian that has spent most of her career in obesity treatment and prevention. She leads a state nutrition action council made of representatives of state agencies serving the needs of limited income audiences with food access. She has also worked with the Cardiac Project in the past. So welcome, Kristin. Can we just have you go ahead and start out and tell us a little bit about the programs that you do?
Sure. So the program that I co-direct is called the Family Nutrition Program, and it is the result of two sources of USDA funding that are both focused on nutrition education and obesity prevention for low-income audiences. So from that, we have our own kind of specific program that we offer in West Virginia, which includes direct nutrition education in schools with youth, and also what we call PSC, or public health policy systems and environmental change. So I'm going to talk a little bit about direct ed. For us, nutrition education. We offer curricula for every age from pre-K to high school. With the pre-K to fifth grade, we focus, just on the basics of nutrition, the food groups, how to incorporate those, but all of our lessons are also interactive and include taste tests, and the opportunity for kids to have positive experiences around healthy foods, because that's not always something that happens at home or other places. So giving them the knowledge and also the skills. As we get into middle and high school, the teaching is focused on how to prepare food. So we do a lot of food prep. We have a curriculum called Teen Cuisine. So it's really the basics of food preparation plus nutrition. And we also do a family class using that curriculum. So that direct education, going back to what Miranda said about the goals, high quality health education, wellness education, those curricula tie into those CSOs, or content standards and objectives. So we're really helping the schools meet those standards by coming in and supplementing what they're doing in the classroom. So that's one piece of what we do through the Family Nutrition Program. The other side is the PSE, or public health work. And in the schools, some of the things we do around that are, we have a Food of the Month program. So that's in addition to those classes we offer and those taste test opportunities, we also do kind of school-based opportunities to taste and learn more about different foods. We support school gardens. We have anywhere annually from like 60 to 70 that we support in some way. And then we tie that into the nutrition education. So garden-based learning. So you're not only learning how, why it's good for you and trying it, but you're also learning how to grow it. And that, of course, is important for health, but also sustainability and food access. So
Kristin, can you explain a little bit about how the school-based gardens work? Do the schools already have the gardens in place?
Oh, well, it could be a number of things. We've started gardens, we've watched gardens crumble. So, I mean, gardens are great when they work. So yeah, it could be a high tunnel, it could be a raised bed, it could be a lot of different things. But also we've done some small scale kind of things, like during the pandemic, we weren't able to get in schools or do a lot of garden-based learning, but our staff came up with kits. So like microgreens are a really fast growing, crop that can keep kids interested because you get a pretty immediate return there. So we've done things like that, like microgreen kits, or, gardening in containers and things. So it doesn't have to be a big production to do that learning. Another big program that we've done is kids farmers markets. So again, focusing around giving children positive interactions with foods. And so this is more on like kind of the shopping end. Encouraging kids to eat produce, and also supporting a local economy and farmers locally. And again, going back to that food security and sustainability, supporting our own folks in our own communities. And then we also have active pathways, which honestly is just stencils on the playground that kind of prompt kids to be active. So it's the most basic of, just giving a little encouragement and brightening up different spaces in the community with positive physical activity prompts. So finally, the last thing that kind of crosses, it's not just school-based, it's a campaign. So it's based at adults and kids. It's called Rethink Your Drink. And that's been going on since I think 2014 or 15. There's a big school-based component, and we've done a lot of promotion there. And really, I think in terms of the policy systems and environmental change, it's been the area we've had a lot of impact. And the program kind of grew itself naturally and being kind of education focused and promotional to, schools and other organizations really latching onto this idea that kids need to be hydrated and also need to have access to water. So we've seen over the past several years, the education component has been paired with the schools getting refillable water stations. So that encourages kids to drink more water and gives them better access. So it's kind of the best example we have of something that's all the different pieces. It's educational, it's promotional, and it's also, there's some environmental change in policy that has helped move that forward. And I think there's a lot more that we do, but those are the ones that most focus in the school.
Has COVID had an impact on the education in schools with your health educators?
Yeah, definitely. So last year we spent a lot of time going virtual. So our educators are amazing. They came up with Google Classrooms and this whole virtual environment, which was so cool. They've really made our programs come to life. Even in the virtual world, we've had a huge decrease in participation. So up until COVID, we would have, over 10,000, closer to 15,000 youth participants each year. And that's in a 6-week class. So, it's not just a one-time thing, it's education over a period of time. So, 15,000 kids would go through that each year. Last year, we were barely at 3,000. So it's had a big impact on our reach in that sense, but that's where it's nice that we have the PSE projects that don't tie so heavily into being in a school and doing that kind of repeated education. When that wasn't available, we were able to kind of shift gears and offer support in other areas. So,
can you tell us about the impact that your programs have had on children?
So what we look at, each child that does a class, each participant, whether it's a youth or adult, does complete pre and post assessments of behavior. So our focus in terms of our goals, even though we teach about, whole grains and low fat dairy or whatever nutrition topic, really we're focused in on fruit and vegetable consumption, variety of vegetables, water consumption, and sugar sweetened beverage consumption. So those are kind of our key behavior goals. And so we see somewhere around like a 30, it varies obviously with the groups we're teaching, but we get around a 30 to 35% improvement in behavior, usually after a class. And it, like I said, it varies. As the sample size changes and the targets change, but that's probably like an average. And then, hopefully public health work, we're sustaining those changes, but we don't always have assessments of those. So
what do you think about the roles that people should play in the school-based efforts, like the school nurse, for example? What do you think they can do with school-based education?
Yeah, well, one thing that I did leave out, you mentioned cardiac in my bio, and cardiac is a program that is supported by SNAP-Ed and the Family Nutrition Program through a subcontract. So we are doing that BMI screening in schools to get an assessment of baseline of BMI in particular schools and counties, and then also hopefully kind of a trend will be obvious, or we'll be able to examine that. And so with that project, cardiac, I see a lot of tie-ins to, getting a clinical professional in there gives some credence sometimes to different things, so, and then, I see that as a loop. There's also a requirement for PE teachers to measure height and weight as part of a fitness gram. So, I see the system of, we have health educators that do the role that we support. They can be a great integrator and great partner within that school to kind of connect those extra resources for education, but also connect back to communities, provide support for family engagement. I've heard from some schools that's an area that they struggle with, or could use a partner in. But wouldn't it be great if the school nurse and the PE teacher work together to measure kids every year? It would be great at the beginning and end of the year to see that, and then really base some sort of program within the school environment, and then also connect with outside the school environment to resources for families and kids. So that's kind of like my future goals. And
yeah, that's a great idea. I think collaboration, everybody collaborating together, it always makes a bigger impact than just people doing it individually, isolated.
Well, there's ways that we can help each other. We hear a lot, the PE teachers are overwhelmed, or the nurses are overwhelmed. They have too many requirements, or things are not structured appropriately. So what I really find is our role in SNAP Ed, the nice thing is we do have a mission for physical activity and nutrition, but we're not bound to any specific kind of thing. Like PE teachers are bound to these competencies, and nurses have to do vaccine updates. Like, we are solely focused on how do we improve nutrition and physical activity and health overall, and we can kind of plug in where it helps to meet that.
Yeah. So do you have any personal success stories about the programs you've been involved in?
So I did write down one statistic. So ultimately, everything we do, we're trying to tie back to like population statistics, population health. And we can't always say we don't have enough evidence to say we caused this, but we did see a 4% drop in adult sugar sweetened beverage consumption in 2017. It went from 40% to 35.9%. It's not a huge change, but it was significant. We actually West Virginia met our 2020 goal for that health statistic in 2017. So not only did we meet a goal, but it was ahead of schedule. So there's that in terms of a success, like with what would be interesting to health professionals. But I mean, there's so many little successes, like I said, about the water refilling stations. I mean, I feel like that has been great because it evolved naturally, and people have really embraced it, and it kind of hits all of the keys of education and promotion. And but there's been goals to met, and partnerships and collaborations that have moved this work forward at this kind of state level. I think there's an openness among a lot of people in positions to do things differently and to do things better. And I think that's also a success. So, but in terms of like a change in population health statistics, I would say that's the biggest success.
Okay. Thank you. Is there anything else that you would like to discuss, or have we reviewed everything? Gone over everything?
You tell me. There's a lot.
I think that's good. I was going to say we do have a little bit of time, so if people want to ask Kristin questions or have any questions about any of the programs, feel free to either put it in the chat box, or we can unmute you if you want to talk out loud. But yeah, I'm really, thank you, Kristin, for being here and talking with us about your programs. It's
No problem.
really great what's happening. Did we have any questions, Jesse, in the chat?
As of right now, oh, there we go. We have one. How can schools get in touch with educators?
So we have educators in almost every county, not every. So the best place to go is your county extension office. They're usually within those facilities, and those are easily found by Googling whatever county and WVU extension. Usually you can get in contact with someone through that method.
Okay. All right, any other questions?
I told you I was quick.
Yeah, it's fine. What I'm going to do, because we do have a little bit of time, but not enough time to go on to the next presenter. So I'm just going to discuss, there were two other strategies that they discussed that they recommended to implement school programs. So the other two strategies, I actually, like I said, there were 10. I picked out what I thought were the most important 5. But so 4 was strengthen the school's nutrition and physical activity policies, which we have done in West Virginia. Keys has actually had a part, especially in childcare policies with that. And I know Dr. Jeffrey did some work with other schools as well. And then number 5 is ensure that students have appealing, healthy choices in foods and beverages offered outside of the school meals program. So, you know, sometimes they do snacks and things that are not healthy. So that was another strategy that they had made. And Dr. Jeffrey, it looks like, has a question about what groups are still supporting water refilling stations. Do you know that, Kristin?
So the Oral Health Coalition just actually got a grant from Sisters Health Foundation to do a round of water refilling stations in the Mid-Ohio Valley. So I know that. A lot of them I feel like have been at the local level. So we've facilitated those conversations. I know, I think a nurse in Greenbrier County, a school nurse, was interested, and I know our health educator helped write a grant and get funding for that. So I think a lot of them are, which is even better, stemming kind of locally from even, you know, PTOs or other groups wanting to fund those. And I know that there was some discussion of legislation where any future school that is built will include refilling stations. And not only, you know, again, great for health, and probably if you keep following the circle, you know, less plastics is also good for health. So environmental health is another great outcome of those refilling stations. So I love to see those going in, and would love the thought that it's kind of a sustainable change with the policy in the school-based health or the school building authority.
That's great. Yeah, Valley actually has a water refilling station. And when I was helping with cardiac screenings, kids were filling up their water bottles. Like, it was wonderful.
Yeah, I mean, that goes into policy too. You know, if the school is interested in installing those, then obviously they'll be more supportive of kids bringing water bottles and refilling them and being a little more. When we very first started this work, and Dr. Jeffries had a big role in that, was with asking kids, you know, why don't you drink enough water? And we did find there were tons of policies around bathroom breaks, you know, people getting extra credit if they never went to the bathroom. And, you know, it was kind of odd stuff. You know, people worrying that if kids had water bottles, they'd put bad stuff in it, you know, and, you know, so those are still policies that I think exist, I'm sure, in different schools, but, you know, if they're installing those water refilling stations, the hope is they're also having other policy change that's allowing better access to water.
Mm-hmm. Yeah. Okay, does anybody have any other questions or comments?
If not, I'll go ahead and take us into the second part of the session.
Yep. Perfect.
All right, so nobody hop off. If you're joining us live today, part 2 continues directly after part 1. So again, we'd like to thank our speakers so far today, and we hope you join us for the next episode. All right, welcome back to Project Echo for Pediatric Obesity, episode 2, part 2. Today's episode is called Improving Our Kids' Health Through Direct Education, Hands-on Experience in School Settings. Just as a reminder for anyone participating today, if you would like to get CME credits, make sure that you put your name and email address into the chat box. If you have any questions while our presenters are speaking, you can put those into the chat box as well. All right, Miranda, take it away.
Thank you. Welcome back, everyone. So today we are discussing about the role that schools play in preventing childhood obesity, and we are referencing an article from the CDC that is called The Role of Schools in Preventing Childhood Obesity. So I was going to share another quote from that article, and it says, with a significant decrease in physical activity rates, the importance of intervention programs in the schools where children spend a significant part of the day has become indisputable. So we are going to talk with Tracy Valash today. I'm really excited that she's able to be here. She founded the Nature's Mountain Classroom, which is an outdoor education program. The first program offering for the nonprofit is called Adventure Pocahontas, and it's a 2nd through 5th grade adventure-based outdoor education program. For the past 9 years, Tracy has also worked for WVU's Family Nutrition Program, teaching hands-on creative nutrition lessons in Randolph County. So excited to introduce Tracy Valash. Are you here, Tracy? Yes.
Sorry, I muted myself and I couldn't find the button to unmute myself. I apologize. I just kept saying, no, no, no. My name is Tracy Valash, and I am the founder of Nature's Mountain Classroom, and I am grateful for this opportunity to speak with everyone today about the program. And we often in public health talk about meeting students where they're at. And like Miranda said, that is in the school system where kids spend most of their time. So when I got to thinking about how we could access more kids to get them out into nature to be physically active, I live here at Snowshoe Mountain Resort, and we have so many local kids who don't ski, and that's kind of where the vision started and then grew from there so that we could actually get these kids not just skiing, but taking part in all the physical activity opportunities that we have here in West Virginia. So I created a 2nd through 5th grade program where the 2nd graders ski and our 3rd graders hike, and our 4th graders kayak, and our 5th graders mountain bike. And this has given us an opportunity not only to teach kids about the physical activities that people come from all over the country to, to come to West Virginia to partake in, but how to do it safely, and then also equip them to take it home and to do it with their families. So for example, our 4th graders got PFDs that they got to take home so that if they want to go boating with their family, they're ready. Same with the 5th graders and their mountain bike helmets, that they were ready to mountain bike safely. And we're super excited. We're actually rolling out our 2nd grade ski program this week, and we'll have 53 2nd graders coming to Snowshoe Mountain to ski tomorrow and take part in Nature's Mountain Classroom. So they spend part of the day doing the physical activity, and then the other part of the day we've partnered with different agencies in the community to do project-based learning, and the kids learn everything from nutrition from our partners at Pocahontas Memorial Hospital to the local bike shop taught the kids all about simple machines. We partnered with the Forest Service, and they got to go snorkeling and put on wetsuits and really get their hands on science. We also partnered with a local fly fishing organization to take the kids fishing, and they're traveling each week to different places within our community so that they can kind of become an extension into their family of, falling in love with a new activity or a new location in our own backyard, and to share that with their families. And the beauty is it's during the regular school day. So they go to school, they get their free breakfast, they get on the buses and come out for the whole day, and they return at the end of the day. and it costs them absolutely nothing. So we're kind of taking down the barrier of entry to some of these activities and showing our families in the community how easy and accessible being physically active in nature can be.
That is so awesome, Tracy. So exciting. It's just so neat. I mean, that's just perfect because it gets them out there and they can do it. And then hopefully they'll go home and want to do it with their families. So what about funding? I don't know if I may have mentioned, did you mention how the program received funding and how you're able to do
Sure.
it?
So one of the things that I did from the very beginning was start reaching out to different partners. So one of them, of course, was WVU Extension and the 4-H program to provide free programming, essentially, because it's what they do. It's the same with the West Virginia Department of Environmental Protection. They have positions where it's their job to go out into the community and do education. So almost all of my presenters, there's a few nonprofits that I partnered with that I found funding to pay them, but for the most part, the presenters are coming free of cost. So they commit one day to come and teach a 45-minute session. They teach that same session 4 times as the kids rotate around to the stations throughout the day. And as far as transportation, Snowshoe Mountain Resort District, which is like essentially the like if there's a city tax, kind of like in a city, Snowshoe has a resort area district tax, and that money you can like request funds. So they pay for all the trips to Snowshoe, which is about a dozen trips throughout the year. And then the local Pocahontas County Convention and Visitors Bureau gave us a grant to fund the trips to the other places in the county. The Board of Education has partnered as far as, you know, covering my stipend and things like that. And then lots and lots and lots of donations from individuals as well as local businesses. But the real donation has been of time and love and passion for the program. Having these people coming out and sharing, like the Green Bank Observatory taught at every 5th grade lesson, and the kids were making stomp rockets and talking about, oh shoot, what's it called? I don't know, they put water in a cup and they were like swinging it around. I don't know. I don't know. I didn't get to join the session. So I didn't learn very much, but they learned so much. And, you know, it's connecting faces in our community so that the kids start to recognize not only what resources are in the community, but careers and opportunities to stay here in our beautiful state and, you know, make a great living. There's so many little pieces to Adventure Pocahontas that have come together that have just been really a beautiful partnership.
Oh, that's really exciting. So do you have a success story for us?
So we do parent feedback at the end of all of our adventures, and 100% of the parents who took the survey agreed that this program was not only a good use of their child's school day, but they also felt like the information that they were learning and the resources they were being connected to were important, and that it's also had a positive impact of how they feel about living in Pocahontas County. I think that was kind of a special piece that we didn't really expect to come out of it. It's been really cool. We've heard from families that have said, you know, we moved here hoping for programs like this, or I can't wait till my kid can participate in this program. And so already looking for sustainability and long range funding. Some of my partners have made 4-year commitments so that we can guarantee a 2nd through 5th grade engagement, which is really awesome. I hate making a program that people can't count on. So we're excited to have some term partnerships. And it was really neat too when we had we did a day in December. We brought 200 kids skiing, 3rd through 5th grade, and 187 of them live here in Pocahontas County and had never put skis on their feet. And it was the most incredible day. And the number of volunteers that came out to help put boots on kids and get jackets on kids and provide resources because so many kids don't have jackets or gloves or snow pants. And we had enough donations to outfit all 200 kids to fill in the gaps of what they needed. And they got to take those items home with them. So they were ready for outdoor physical activity all winter long because of the program.
That's wonderful. It's wonderful. And actually, when I was doing my research about education in schools, that was the one thing they were talking about, is that is the drawback with doing education in schools, is that a lot of time it's short-term programs. And so you really need that long-term program to really have a really good impact on kids and to really make that effect. So that's wonderful that you are already thinking about sustainability, because that really is what it has to become, is that it's part of school education, that this isn't something we do a program for 6 weeks and then it goes away, that we really make it something that is done long-term. So it's wonderful. So can you tell us the benefits?
We're very excited. And the fact that they get to get 4 touches.
Go ahead. What did you say?
No. I was just saying, one of the reasons, a lot of schools might go tubing one day or they go biking one day. But the beauty of this program is it's actually a 4-week curriculum to where they get to have 4 different experiences on the same type of skill, so that they get to see 4 different places they can do that activity, 4 different opportunities to give it a try. I mean, we had kids who had never ridden a bike before, and by the end they were pedaling a bike independently and things like that. And that wouldn't happen if I only got them one time. So we're going deeper instead of just scratching the surface. So that's been really special.
Yeah, I think it's wonderful. So can you tell us some benefits to being active?
Yeah, so there's some great data out from the Be Active West Virginia site. And I found some of this last night, and it was like, I was kind of geeking out on the numbers and the impact. So West Virginia as a state has 567 miles of rail trails across the state, in addition to other public lands that we have. About 23-ish% of our land in West Virginia can be used for recreational purposes, whether that's running, biking, hiking, and things like that. And studies show that just one 30-minute visit to nature can help decrease decrease depression and increase mental health. And then it just skyrockets from there. 5 to 15 minutes a day of brisk walking is tied to health benefits and an additional 2 years of life. The other one, I forget it off the top of my head, but I think it's a 7 to 11% increase in mortality rates for people who are physically active. And the big one is 150 minutes per week of moderate to vigorous physical activity can lower the risk of heart disease, stroke, type 2 diabetes, high blood pressure, dementia, and Alzheimer's. And I mean, if that's not convincing enough, I don't know what else is.
Yeah, that's amazing. It's amazing, the benefits, and so many of us don't use it, including me. I have a hard time getting out, but I'm trying to do better with being more active. So. But all right, well, thank you so much, Tracy. Do you have anything else that you want to share?
No, I'm just excited to be included and would love to see more programs like this across the state.
Yes, it's so exciting. Thank you. You're doing incredible work there. All right, so our last presenter is Alicia Fox, and she is the director of Marshall University Nutrition Education Program. She has been a registered and licensed dietitian for 7 years. Her background is in clinical and community nutrition management, and she has a special interest in diabetes education. So Alicia, can you tell us a little bit about the program? Oh, you're muted.
Oops, okay, there we go. All right, thanks, Miranda. So as she said, my name is Alicia Fox, and I'm the director of the Marshall University Nutrition Education Program. As we are a subcontractor under WVU Extension, so as Kristin spoke earlier, we work under her organization. So a lot of her goals are our goals and objectives, and a lot of what we do is similar, but we are different. So With our program, one big difference is our team is made up of registered dietitians. So we have 4 registered dietitians that go out into the community and teach in local elementary schools that qualify for free or reduced lunch. So they teach kindergarten through 2nd grade, and we utilize Show Me Nutrition, Discovering My Plate, and Serving Up My Plate. So they do 30-minute lessons, 7 lessons in each grade, K through 2, same schools every year, but we incorporate books that are in the accelerator program. In that lesson, we have a review, and we cover each food group each week. And then we do a book, like I said, accelerator reading, and we do a physical activity component as well in each lesson. So it might be the week of grains that we have yoga that is kind of representing parts of harvesting wheat and getting flour and mill or something. So each week there's a little activity component just to get them up and moving and give them a break before we do a food tasting. So we do research every year. The past 2 years, because of COVID, it's been a little bit different, but we always get a great response with our food tastings. A lot of the food, so we're on a 3-year cycle because we have the same students for 3 years. So it's a different tasting every year. And a lot of times these students are foods that we may think are ordinary foods, everyday foods, but they're not to them. So it's amazing how many kids haven't tried a tomato or broccoli is white cauliflower. It's to see a kid try, for example, one kid tried cottage cheese and pineapple. And to me, that's, you know, a staple in our home. And just like, wow, this is so good. And not because they had never heard of it, but the fact that at home, they would never try it for their guardian or parent. So they tried it in school because we're always, let's be brave. Let's try this together. We ask that everyone try it. They don't have to like it, but we just ask that they try it. So it's pretty cool whenever you see a student that was for sure they didn't like a food, but they were going to be brave for their classmates and they try it and they actually like it. And then a parent sends back a comment card and says, oh my goodness, like my child has refused to try, we'll say cottage cheese and pineapple again. And this week at the store, they asked me to buy it. Thank you so much. So they're always being brave and trying it. Every once in a while, you'll have a student that just doesn't want to, but students really want to be like their classmates. So they're going to try that food. They're going to be brave. So they do the tasting, we talk about it, and we try to get the students not just to taste the food, but let's have the whole experience so they can be mindful about it, so they can smell it, they can look at it, and not just hurry up, eat this and be finished with the tasting. And then we send home every week some sort of reinforcement material with whatever lesson we talked about that week, along with the tasting sheet. So they'll be able to take that home, and instead of saying like, we tried this fuzzy fruit and it was green and I can't remember, they know that it was a kiwi that they tried. So they've got, they're able to say, okay, I'll get you some kiwi at the store. And then we also send home a little newsletter. So if it's about dairy, it might have some information about dairy on the front, and then there's an activity sheet. So they can go home, they can have these key points to remember and talk about with their family. And then they also have some sort of activity with it as well, just to kind of keep that in their mind. And then when they come back the next week, we always ask like, okay, so last week we talked about dairy. What did you try new last week? Or have you had any dairy today? So we always are trying to not just go in and teach, but we're keeping it interactive the entire time that we're there.
Are those sheets from a certain curriculum, or do you guys make up newsletters and everything? You make them?
Yeah, we make them. So there are sheets that you can get, like top 10 sheets from the USDA, but we, because I haven't got to that part, but we have the graduate dietetic interns. We have a lot of free help. So it's really nice because I'm not that tech savvy. They are. So I had no idea what Canva was until like 2 or 3 years ago. So they are very good at making these handouts. So we love to utilize our interns and get handouts. So yeah, we do make them, but I'm happy to share them. So yes, we make all of those. And so we do the lessons. We have our interns that teach in our schools, our educators that teach in their schools. The interns, they will be eligible to sit on for their exam this summer. So this is part of their 1,200 supervised hours that they need in grad school to be able to sit in on the exam. So we're very fortunate to have all of them available to us. So we do our education, but then we're involved, as Kristin talked about, with gardening and Rethink Your Drink. But we also do work with our school pantries, the backpack program. So obviously we're in low income areas, so we are involved even in a pantry on Marshall's campus, but we try to make sure that there's an educational component to that as well. So if we're sending home a $5 meal that organizations have collected food and we've made a bag for them, we make sure that we've got all of the information for them about how much it's going to cost. Here, it's got all of your food groups, where can you purchase it, but also about those food groups. So it might be 1 month we send home a protein handout in the backpack program. Or we might have a tasting for foods that we have an extra amount of supplies in at that time at a pantry we're working with. So we are always trying to find a way to continuously add a little bit more extra information and layer what we're teaching, because we know the more that we layer, the better off that these they're going to start implementing the behaviors and the education that they have learned.
So do you partner with the backpack programs? Like, how does that work? Because I know, a lot of times backpack programs are not actually, they don't give kids healthy options. So do you guys have a hand in what is given to the students, or you just give the information?
No. So what we do several years ago, so things have changed over the past years. We used to do a lot of healthy food drives for the school. So we would have a food drive, request certain foods, weigh them and see how much healthy food. So we would know specifically what we were receiving. Things have changed over the past few years, so we don't do that as much. But if we're doing like a $5 meal bag and we are working with, I'll just say the department students here, we'll say, okay, we need for this group to bring pineapple, this group to bring brown rice, this group bring canned chicken, and this group bring green beans or whatever it is. So we know what we're sending home that way with the actual recipe, because we've already developed the recipe and we're sending home something specific. But say we are, someone who's just said, hey, we're going to have this food. Can you just make us a material to send home? It might not be that it's our first choice of food for students that's going in that backpack program, but we're going to tell them, because we never want to, in our lessons or anyway, to shame anyone for what they're eating, because, we're with kindergartners, they're not making the purchasing decisions.
Right.
But let them know that, okay, you're getting whoever's going to fix it. Here are your green beans, but how can we make these canned green beans healthier for you? Or what's an inexpensive protein that you could add to these items going in? And it's kind of the same way in the classroom. So we always, like whole wheat is best, but if you only have white at home, if you can choose the whole. But we always try to make sure that we never have any message to where it can be conflicting of, I better not eat this, it's not healthy. But on that same note, we're not saying go out and get a milkshake. So I mean, we're sticking to our message, but when students ask, we want to make sure we're letting them know how they can make it work best, or the family. And that's the same thing when we're doing events at schools as well, with the parents or teachers or guardians, that we can do, that you can make inexpensive, healthy meals and snacks for low cost, and not have to always feel like eating healthy has to be expensive. And that's kind of how we always are, if we're talking about fruit, we're letting them know that you can get frozen fruit and it has the same nutrition as fresh fruit if it's out of season, or talking about the seasonal produce. So we are always, that's a big part for us, is just trying to make sure that people know it's affordable. And for some, it might just be giving them the resources sometimes that they don't know about that are available to them.
Mm-hmm.
But that's more like when we're with the parents and things. But as far as for the students, we always let them know, like, you can buy this at Dollar General in the can section. So we always tell them where these things can be purchased for their at home.
So what impact have your programs had on children? Do you have impact or success stories?
So everything we do is research based. So, you have your you know, this every year we see we do a pre and post survey on schools. So we know what percentage of, you know, this class has increased, or this grade, 32% of their vegetable consumption, or they are now drinking milk. And those statistics are for our group as a whole, but every week we're getting back feedback from parents. And sometimes those things really hit because it's personal. We're in the class and we see that student that day. And it could be that child that runs up and says, there were radishes on the salad bar yesterday and I tried them because they've talked about radishes because of the school garden. Or again, the parent sending the comment card. But we consistently every year see marked improvement in increased fruit and vegetable consumption, milk consumption. We talk about the importance of playing, physical activity in each lesson. So we have all of that as well. But one thing is the fact that and our teachers love it and they want more of it and the students want more of it. And they're always like, thank you, thank you, thank you. Our students would never have this information, this education, if it weren't without you. And just seeing kids' faces light up when they get to try a food, or wow, I've never seen this, and then they like it. And to me, like, that's one of the biggest successes, is just seeing them being exposed and like it. And you know what, they may not like it the first time, and that's okay. But a success is they still tried it, to me. So, and they're getting that exposure. So, I don't know, we see success every day and it's really exciting. I love this field. It's fun to work with kids.
Yes, it is. I agree. Do you have anything else you want to share before we go to questions?
I don't think so. I think that's about it.
Okay. Thank you.
Thank you so much.
It's great what you guys are doing as well. All right, does anybody have any questions for any of our presenters? They're all here, so if anybody has questions, feel free to put it in the chat or comments about what we discussed today.
I just wanted to comment on Alicia's presentation, and you know, talking about giving kids opportunities to try things and seeing that impact. I mean, it really is so important. And thinking about our target, which are low-income audiences who struggle with having enough food. And so you can imagine, anyone who's had kids on the call, you know, kids don't naturally usually love broccoli or butternut squash, or let's face it, sometimes adults don't naturally love that. So, you know, if you have a limited food budget and know that your child might reject a food, and that's going to be in place of something else that you know they'll eat, you know, then we're making those choices, right? Because we want them to have food and be fed, and it's important that they eat something they like. So these programs, I think, we're giving those kids those opportunities, but we're also helping parents who probably, you know, would love that their kids would eat healthier, but maybe just don't have the knowledge or the, you know, the time or the even maybe funding to kind of present these experiences at home. So I think it's really, we're serving the adults and the families, even though we're working directly with the kids, because we're helping them encourage those healthy behaviors. And I think Alicia did a good job of bringing that up.
Yeah, that's a very good point. Because yeah, you do need to reach everybody. It's the whole family. Dr. Jeffrey asked a question, Alicia, for you. I think she was asking, are the pre and post with just the students or with their parents? I think the surveys that you had.
They're just the parent or guardian. Just because of the age group we're with, they go home. We take them a week before we start teaching. We collect them the week that we start teaching, and then we send them home the last week and then go back a week later and collect them. But the comment cards, they go home every week after that lesson. But it's all for, now on the comment cards, the parents or guardian may say, my child tried this new food this week. So the behavior is related to the child, but it's actually completed by the parent or guardian.
Okay. All right, thank you. Any other questions? Thank you everyone for being on today. Mayor Cavalier is saying that presenters brought out important information and their presentations are very appreciated. It's sad to think the things we take for granted are unknown to so many families. For instance, I ate avocado toast, homemade bread for breakfast. It's easy to forget not everyone is familiar with or likes such foods. And that is a big issue. There's another article that I will send it with the link, but it's actually really good. It's called The Need for a School-Based Student Obesity Prevention Program, Perceptions of Rural Elementary Principals. And they actually interviewed elementary principals in 8 rural elementary schools in North Central Texas. And they asked them questions about what would make their obesity prevention program successful. And it's really neat to see their thoughts, but they actually break it apart. That article breaks it apart by each research question, and then they give the responses. So it's very eye-opening and enlightening about what we can do to make our programs more effective. So
I'll wrap this up. Well, thank you again, everybody. It was fantastic. I learned a lot, and I'm excited about all of the cool programs that are going on across the state and all of the different things that people are doing to intervene. So, no questions. I guess I'm going to take us out. So, give me one moment.
5210. Every kid, every day. Let's have fun the healthy way. 1, 2, 3, 4, 5 servings of fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. And let's go play outside. 1 hour. Tiger it, my turn to hide. 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day. Let's have fun the healthy way. 5, 4, 3, 2, 1.
All right, everybody. Thanks for joining us.
bye, everybody.